So welcome everyone this morning to our first conversation in our second series of COVID-19 and equity conversations. I'm thinking that everybody can hear me. This is a 5-part conversation series, so we have planned for five conversations between now and early April. And we're really looking to, with you, examine the relationship between the COVID-19 pandemic and health equity, and looking to equip all of us, all of the participants and all of us, with an understanding of what those key ingredients are and what are the approaches to implement and sustain change that really does truly prioritize equity for all. My name is Claire Betker, and I'm the Scientific Director for the National Collaborating Centre for Determinants of Health, which is one of 6 national collaborating centres for public health that are located across Canada and are funded by the Public Health Agency of Canada. And we've been in existence for 15 years now, having been put in place post-SARS in and around 2004. I want to start by, there's a threat there. I want to start by acknowledging the land that I'm speaking to you from, and you can see the sunshine here. I'm in a bitterly cold but brilliantly sun-filled environment here in Winnipeg, Manitoba, which is in Treaty 1 territory, which is the traditional territory of the Anishinaabe, the Cree, the Oji-Cree, the Dakota, and the Dene people, and it's on the homeland of the Métis Nation. And I want to respectfully acknowledge that we all, and there are folks here from all provinces and territories across Canada today, that we all live and work in the traditional lands of the many Indigenous people of Canada. The National Collaborating Centre for Determinants of Health is hosted by St. FX University in Antigonish, Nova Scotia, and the NCC is located in the ancestral and unceded territory of the Mi'kmaq people. And that territory is covered by the Treaties of Peace and Friendship, which the Mi'kmaq and the Maliseet peoples first signed with the British Crown in 1725. And those treaties did not deal with surrender of lands and resources, but in fact recognized the Mi'kmaq and the Maliseet title and established the rules for what is an ongoing relationship between nations. So I'm going to start with a few housekeeping items. First, this is the first conversation in our series, and we've planned for 5 conversations, and each of them will be held on Wednesdays at 12 noon Eastern Time and are scheduled every other week. So our next conversation is on February 24th at the same time. And in that conversation, we're going to follow on from what we're talking about today, but really looking at case examples and equity-focused both research and action within the response to COVID-19. And we're really pleased today to be partnering with the Public Health Agency of Canada, the Office of the Chief Public Health Officer, and we're also pleased to have Stephen Hoffman here from the Canadian Institutes of Health Research. Just a little bit about our audience that are registrants today, and I'm just going to take a peek. There's 179 of you online right now. It's interesting, we had over 460 registrants for today, and it's often around 50% that are able actually to carve out that time and to come. But of those registered, you came from coast to coast to coast. So every province and territory was represented in that registration. And we asked you in the registration 4 questions and 4 topics. And I'm going to encourage you today to really use that chat box down. If you hover, I'm sure we're all pretty familiar with how to use Zoom. But down at the bottom, there's a chat box. And I really encourage you to introduce yourself, start a conversation, take a look at who's here and with us today. And if you want to reach out, please do. If you've got questions, comments, ideas, if you want to share ideas, share questions, that would be fantastic. We do have simultaneous translation going on right now, and you can see on the screen they're highlighting the numbers that you need to call into. So check in that text box, please, for those of you who would like to tap into that translation. there's a number there to dial, and then you're on telephone with those interpreters. So it will be translated from English to French. Just a little bit about the audience. 30% of you are from academic institutions, including many students, so who are our future, and we're really pleased that you've joined us today, and that we hope that you'll join us for the next series of conversations. But I think really importantly, 40% of the registrants indicated that they work at a local or at a provincial or at a national public health organization. And I just want to take a moment right now to thank you for all of your incredible work over the past year, no matter where you are within that public health organization. And I really want to honor you for the effort and the work that you have done to keep us safe and to keep this thing at bay. So our conversation today will be recorded, and it's going to be shared with registrants via email, and it'll be posted on our website for future reference or for those who are unable to attend today. As I said, use the chat box. Introduce yourself, and members of our team, the National Collaborating Center for Determinants of Health team, will be monitoring it and adding resources as we go. And I just really want to acknowledge Claire O'Gorman, who's a knowledge translation specialist with us, who's done a lot of the hard work, behind the scenes work for these sessions, Danielle McDonald, who's managing the technical part, and Jamie Stife for her brilliant promotion of this. Thank you to the team. So please use the Q&A. If you hover at the bottom, you'll see a Q&A box for questions, and feel free to ask your questions in both languages, French or in English, and we will certainly answer as many questions as we can today. As I said, this is a second series of COVID-19 conversations that we've hosted, and the first series included 5 conversations that were held on the 5 Wednesdays in April 2020. And the focus there was on what was needed to be considered in terms of taking an equity approach to planning and responding. And in this series, we really want to hear about how you've responded using an equity approach, where those barriers and opportunities are, and what you might need to move that forward. Those recordings are on our website, and I'd point you there. And we had 13 speakers in those 5 sessions, and they spoke from a broad range of public health and community organizations and thus perspectives. It's very rich conversations. So today we're going to start by learning more about the Chief Public Health Officer, Dr. Theresa Tam's annual report for 2020, and it's titled From Risk to Resilience, an Equity Approach to COVID-19. Then Dr. Stephen Hoffman with the Canadian Institutes for Health Information will share work that he's done with the United Nations and through CIHR. And we'll have a conversation guided by the questions that you provided actually on registration. And we really want to explore the interplay between the social and structural determinants of health, health equity, and COVID-19 planning, response, and recovery. So really looking into that future.